The varicose veins were painful, not terrible, but sort of the heaviness in the legs.
It was a throbbing pain, especially behind the knee area where the vein was. So it definitely painful when I was standing up or exercising.
With varicose veins, I had some problems after my first pregnancy, but not enough that I was wanting to take care of it at that point. And I had some fears of people that said, wait till you're done having children. With my second child, it got extremely bad.
The vanity and also the discomfort. Sometimes I do feel like a funny sensation in my leg. My legs are throbbing.
The most important factor in developing veins is a congenital predisposition to develop veins, which you are born with. There is a fault between the wall of the vein or the vein valves, and then certain factors we call accelerating factors will make these veins to appear, and that of course hormones, pregnancies, lack of exercise, etc., etc. I'll light a little bit. Miss Collard, who's going to have the endolaser procedure today. And what we'll do is we'll pass the laser from this point to the groin, seal the main vein, and then with needles we'll wear 2 or 3 little nicks, and with little hooks we'll remove all the superficial bulges.
I waited because everyone is always taking preference, you know, before me, so now it's time for me. My expectations, to get rid of this vein, no bulging on this right leg, hopefully less black and blue looking, and hopefully I'll be happy.
Only one patient, maybe 40, will need endolaser procedure or some type or mini phlebectomy. The surgery that was done to remove the main vein, ligation and stripping, now has been replaced for more modern procedures, the endovenous laser ablation, in which with laser energy we seal the main vein, and it's done in the office with strictly local anesthesia. It takes about 45 minutes, the patient is awake, and following the procedure, the patient returns to work. This procedure we developed here at the Vein Treatment Center between 1997 and 1999. It was FDA approved in 2002, and we are owners of the patent. Now we are releasing the laser energy and sealing the vein. Most patients come early into disease and can be treated with just sclerotherapy. Like everything in medicine, the sooner you treat the problem, being spider veins or varicose veins, you'll have a faster result, a much more cosmetic result.
Did the sclerotherapy more than once before you decided to I had nothing done so far. It's all new to me. I'm a little nervous. I think they want to do injections for my veins. There's some question as to whether the solution will affect breast milk. So there's not a lot of information about that yet. So I'm starting pretty early, but it's summer. I cannot stand the way my legs look. Okay, now I'm going to inject a needle that's very, very fine. Usually we'll treat varicose veins due to pregnancy 6 weeks after delivery. By that time, the veins have come down in size, but what's left after 6 weeks needs to be treated, to be taken care of. I don't know what to expect right now afterwards. I'm hoping that my legs will look perfect. From before and after pictures of research, I doubt that will happen, but this is my first time. I'm new at this, having listened to some other women talk about it. I'm feeling a little better about what the outcome might be. My pleasure. Thank you.
Within the first session, shrunk down, flattened quite a bit. Went back to work. The next day, back to pushing my kids in the stroller up and down the street and lifting them up, and everything was easily back to normal.
Well, you could see that the lump went away right away, with that bulging went away right away, and I was on a beach in 2 weeks. It was quite easy. I was fearful in the beginning because veins cutting, I was worried that it was going to affect something else, but it's been fine, and I have no pain in this leg anymore, and it looks better too. So,
if patients are going to have their spider veins or varicose veins treated, they should try to find a physician that does veins exclusively or almost exclusively. And then they can do it two ways. One, they should go to the American College of Phlebology website to find doctors that specialize in varicose veins, and they should do their own research on the web to find doctors in their area that specialize in veins, and of course word of mouth by patients that have been to that specific doctor and have achieved good results. Specializing in phlebology, which is the treatment of varicose veins and spider veins, is very gratifying. Since the results are superb, patients do not live with them, and consequently, almost all patients are very, very happy.